most famous physical therapist on the internet.
Hi, folks. I'm Bob Schupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about common pain makers causing pain in your neck and arm and how to get rid of them. So our goal is you want to, of course, decrease the amount of neck and arm pain you're having. So to do that, we're going to show you exercises and all sorts of other things, positioning. But it's also important for you to decrease the things that are causing the pain in your life.
And you might say, well, it hurts all the time. Everything
Right.
irritates it. But we're going to talk about how you can find a few things out, because we've heard those comments many times from patients.
And they're usually wrong.
After a little discussion, we find out, oh, well, they say it really hurts when I do this. And then we go into that area, and it becomes very much clearer that
It becomes clear as you stop doing some of these things. Then it becomes, you start finding out that, things are causing my pain.
Right.
Like, let's say you sit in a chair with your head bent down, and after a while, maybe you fall asleep in a chair.
Sure.
And your neck falls down and your head falls down. And that causes increased pain. And that pain goes on for a couple hours because of that.
Sure.
So, and you stop doing that, all of a sudden you maybe have 2-3 hours of pain-free movement. So,
Yep.
it could be pain in your neck or even referred pain down your arm. If you perform a task and it increases your pain, it's a pain maker in our book. If you move a certain way and it increases pain, it's a pain maker. If you're lying in bed and that causes pain, it's a pain maker.
It may be something as simple as just posture you're not aware of, and it's, you have poor posture, you have no idea, until someone takes a picture of you and you look at it from a certain angle.
Or like the bed example, you think, well, I'm lying in bed, why am I having pain? And maybe you're lying with too many pillows.
Sure.
So, the other problem with the pain is that the more pain you have, often the more sensitive your nerves get. So now, rather than taking a large event to cause your pain, it only takes a small trigger. You know what I mean? So
Right.
This does not require, the nerves become so much more sensitive that what used to cause a lot of pain hardly takes anything now to set it off.
And you can think of that. It's going to be painful when you move this direction or when you're going to do this activity. So even before you get to it, because
you're starting to feel pain. Yes,
and that can all trigger into the whole pain cycle.
Right. So the cycle is heading the wrong way. It's getting worse and worse. Now you can also head it the right way by taking the pain makers out of your life. You can see that you can control the pain.
That's a big deal. When you find out you can control it, that's huge.
Yeah, it doesn't have to control you. So what Brad and I thought was that we'd go over some things that you probably should do right now.
Sure.
And Brad and I will go back and forth. And now, number one, I would not look down continuously right now when you're having neck pain while reading, knitting, or performing desk duties. You want to try to get things. That's how we often talk about setting up your office or home computer, making sure the screen's high enough so that you don't have to look down.
In our society, these are challenges that...
Yeah, they are challenges.
Yeah, and number two, we're continuously looking at a phone or a laptop. Phones are, pretty much phone is the new TV.
Yes, it is.
So we're down looking at the phone, putting stress on the neck. And it's one of those things, when you do it immediately, it doesn't cause pain, but over 20 minutes, it gets into that flared up mode, and then you don't really realize that was the
You don't
problem.
even realize that it's sneaking up on you. So bring that phone up, by your face, basically, is what you need to do.
See, walking down the road like that.
So just a general is putting the neck in what we call the forward head posture. So, that neck is geeking forward. I know you can't see it on the podcast, but this is such a common position that we see with sitting and working and even lying down sometimes. So
the pillow issue again.
Yeah. All right, Brad, what else we got?
Oh, sleeping on your stomach or your head is turned to one direction as far as it can go, and that's fine. But if you lie there for any period of time, that's end range on the joints, which is a common therapist term that we know we don't like to put our joints at end range for prolonged periods. It irritates them. So no more sleeping on the stomach.
Yeah, I mean, if you do it for a very brief time. If you just want a
You know,
little,
hopefully, if you're doing people that do sleep on their stomach that don't have any pain, they probably got pretty
good
mobile
range of
neck,
motion, right?
and they probably turn their head right to left
Sure.
frequently without even knowing it.
Sure. All right. Like we alluded to a number of times, is sleeping on your back with the wrong number of pillows. Generally, when you're sleeping on your back, we'll go into this in another video, is you want to have a thinner pillow so it doesn't move your head and neck forward.
And the same thing with sleeping on your side. You've got a different posture you need to accommodate so that your neck is not stressed. And we'll cover that probably in the same video.
In the same video, right. The other one, number 7, don't sit in a slumped, rounded position. Now, this says, well, what does this have to do with neck? Well, if you're like mid-back is rounded out, there's no way you can have the neck in good posture.
Right.
It just follows suit. So you got to have the entire spine in good posture, or your neck's going to be in bad position.
And this is one of those things where it comes into play with our next thing, watching TV.
Yep.
You know, it's all that slump posture, sitting in your car, sitting anywhere. And, you know, Bob, we both know that, particularly with younger kids, you ask them to sit up tall and straight with good posture, and a lot of times they'll say, well, it just feels so weird and it's not even comfortable.
I know. Who sits like this, they say to me. I mean, and they don't realize how bad they look the other way and how good they actually look.
Right.
But the other thing with that, Brad, with that same point, is that you don't want to have your computer screen off to the one side either, or TV off to one side.
Sure.
If you're constantly looking, let's say, to the right, you're going to develop pain on that right side of the neck possibly.
Right.
So you want to have the things right in front of you.
Right.
Even if it's a slight off, it's not a good thing.
This is one of those things that the older you get, the more you realize these irritants.
It becomes very evident with you as you get older because these things crop up. And
I think particularly over the age 50. I just had a physical, and the doctor said once you get over 50, things kind of start changing. It's like, well, that was my experience.
Well, Brad and I joke, something new crops up pretty much every day.
Nothing major, but you know, little things that you used to be able to do.
Cycling with your the head down posture, Brad. You're a big biker. I do some biking, but
yeah, and it depends on the type of bike you got. If you've got a bike that is more normal, that keeps you upright,
right,
you're going to have less stress on your neck. I
you're
have
just not going to go very fast.
I have the bike that you lean forward and go in the aero bars, and it is. It's not that comfortable.
It's a challenge.
I've got to sit up every now and then and stretch my neck because it's a little uncomfortable.
Yeah, and you know what I do when my bike is upright, but I often like take my arms behind my back and stretch it.
While you're riding?
Yeah.
Oh, you can let go of the handlebars.
I can let go of the handlebars, but I started thinking maybe I shouldn't do that anymore because boy, if I go down, I'll go down.
Yeah.
So all right, number 10, you're Brad, number 10, right?
Oh yeah, driving with incorrect posture. Same concepts that we were talking about. The thing in a car, you know, you can adjust hopefully your lumbar. If your lumbar support is good, makes it much easier to have good posture in your neck. So make sure you've got that adjusted properly.
This next recommendation is with a caveat because if you can run without pain, I absolutely recommend that you run.
Sure.
But if it's increasing your pain, one might be that you have bad posture while you're running, and then it's actually the shock absorption is making it worse.
Yeah.
So, but generally, you know, running is good for you as far as increasing the oxygen to the area and the healing power.
Sure.
But you got to have good posture while you're doing it. We have a neighbor lady. Oh, I want to go out there and I want to put my knee between her back and just pull her shoulders back.
Just go out and do it and see what happens. She'll probably thank you for it.
Yeah.
You know, there are a small percentage of people actually run, I think, overall, but
yeah.
It's something good to point out. Oh, here we go. Next one, sporting activities.
Don't do them if they increase your pain, basically, right now.
Or change how you do them. Maybe it is a postural thing or something of that
But
nature.
we're not saying that you can't go back to it, but we want to calm things down. We want to calm the pain down.
Right.
So let's say you're having pain while you're playing tennis because you're turning your head a lot.
Yep.
You know, wait till we get the pain knocked down again, and then you can gradually go back into tennis again.
Boy, that sport, just with the abrupt changes in directions.
Right.
There's more than...
I think the big one now is pickleball.
Oh yeah, that is becoming very
Yeah,
popular.
that's very popular. So
Do they eat pickles? I don't.
no,
I haven't
no,
got into it
I
yet.
haven't got either. So lifting weights, I'm going to tell you, it's fine to lift weights as long as it doesn't increase your pain. But if it increases your pain, you can't do it.
Well,
It's
weight,
simple.
body mechanics is so critical in lifting weights, and there's a lot of people that lift that aren't aware of their poor body mechanics. So make sure you get some proper instructions.
Yeah, you want it, pretty much you want your spine nice and upright and completely erect when you're
Right.
when you're.
And that's why
lifting.
a lot of gyms have mirrors so you can actually
Yep.
see what's going on with your posture.
Not just to look at yourself and see how big you're getting or toned you're getting. So, number 14, Brad, that's you?
Oh, working in a cramped or awkward space. That's very typical with a lot of computer workstations.
Yeah.
You put everything into one area so you can work, and especially now with COVID, if people are trying to convert things into their
What
house.
about a car mechanic or a painter? Those they're really.
Well, yeah, it
buying
depends.
for a
I
lot.
mean, when I was working on equipment doing
Oh
service
yeah, you
calls,
were working on engine
Oh, yeah.
motors.
yeah, I'd get into service calls where I'd be almost upside down and trying to reach under something and you need 3 elbows just to get your arm around. If you're a mechanic, you know exactly what I'm talking
Yeah,
about.
and then unfortunately with that, if it's your livelihood, there's nothing you can do right now. We'll try to show you some things to do in between.
Yeah.
The
The elevating workbench can be a really
big
handy
help.
tool
Yes.
for something of that nature.
If you tilt your head out of habit in the same directions, a lot of you don't know you even do this. I do this when I'm doing notes
Yeah.
or writing. I'm always tilting my head to the left, actually. I think to the right, but I actually tilt my head to the left. So as an exercise, actually, I have to tilt my head to the right, the opposite direction. That's just, we'll go into that later.
Yeah.
But
Yep.
you want to try to avoid those, especially if it's a daily habit. You're doing, hour upon hour, day upon day, years upon years.
Yep.
It starts, all of a sudden, it'll start giving you pain.
Yep.
So,
Shopper's tilt.
yeah, well,
Is that referring to the same as shopping cart?
no,
posture?
shopper's tilt is when you just carry some bag or something on just one side.
Oh, so if you got a
So-
big purse or something of that nature, or even
Or
your backpack.
If you bought something and you're carrying it all in one hand, you're
like-
supposed to spread out the
So you should buy 2 of them. So you
That's
can
right.
Carry one in each arm.
That you can tell your spouse. I was supposed to buy 2 of these. Bob Brett said.
That's right.
So keep the weight evenly distributed. Number 17. It's kind of repeat there. But what they're talking about is if you're carrying a heavy suitcase at the airport. Again,
Get 2 of them.
you want to get a rolling one.
Right.
You know,
Yeah. That I don't even know if they make them the other way anymore.
Yeah, I know. My niece just was having trouble with this. She flies a lot, or was flying a lot,
Yeah.
and she was getting like thoracic outlet syndrome.
Mm-hmm.
And all she did is, I don't know why she didn't have a roller or what. I think there's times
She
where
probably wanted the exercise.
well, I think sometimes you got to lift it up to go upstairs or something. You know what I mean?
Yeah.
And she was using always one arm, and she has a purse over her neck, and
Did you straighten her out?
it was straighten her out.
Oh, good.
Straighten her out. So anyway, you don't have to. You want to again decrease the pain, so you decrease the sensitivity of the nerves. We're going to show you some exercises to help you also along with this, but the pain does not have to be permanent. We're going to help you get rid of it.
Yeah.
This video, by the way, is a part of a series of videos on neck pain. So you go to bobandbrad.com, go to the program section, and look for neck pain. And you'll see a whole series of videos
Yes,
on
go
neck
to
pain.
go to the one that fits you. Don't worry, they're not all just talking like this. We're actually going to show you some exercises that we've had great success with patients, and you can work with them yourself. And there's a PDF printout to show you the exercises once you turn the video off, so that you can refer to it. A little review of the video. It's a great thing. There's no email or anything. It's all free and ready for you.
Like this one, for example, we got a list of the 17 things you should do right now.
So they can just
go
read
back.
them.
Yeah,
They'll probably print it off and not
Yeah.
even watch the video.
that's right. So, all right, good luck with you.